Well, hello everyone. We're really glad you joined us. You have been learning about the Strategic Prevention Framework, the SPIF process, and prevention science. That's all a part of this module. And in this conversation, we want to talk with you about implementation and what it looks like on a day-to-day process, how it kind of comes to life from textbook out into a county community. So we have with us Marge Giannopoulos, who is also with Youth First, and she has been doing this coalition work in Warwick County for a decade now, and they're planning a party, but we also want to take a minute to reflect on the learnings from the work that's been done there. So I'm just going to ask Marge some questions, and she's going to help fill us in on things. So first of all, Marge, what was it like to bring stakeholders together? Remember, that's step one. How'd you get everybody on the same page?
Well, it was a pretty intimidating process in the beginning, but I had very good resources through Youth First, and Warwick County Cares was really born out of a solid foundation of Youth First. Youth First was awarded a grant to implement a strategic plan called a 2-year process called Communities That Care, which transitioned into the Strategic Prevention Framework, or affectionately known as the SPIF. It's a way to assess the community needs, looking at risk and protective factors and other data. It was a lot of relationship building, and I'll get into that a little bit later, but we have to have 12 sectors from the community. So I engaged with these, and these were included school, law enforcement, faith-based, government entities, youth, parents, businesses, civic and volunteer groups, the media, organizations that work with substance abuse, medical or health, and then other youth organizations, for example, Purdue Extension, which has 4-H, and so they've been a really big partner with us from the very beginning. So we started with an introductory meeting, which included key leaders, so school corporation superintendent was there, the sheriff, other social service agencies. They're already providing services in the community. We talked about what the SPIF was, and we wanted who else should be around the table to gain representation and should know more about what our process was. That phase took anywhere from 3 to 4 months of daily work. Yeah.
Every day.
Daily work. So people need, organizations need a lot of education about the process, and to begin to develop a perspective about the community need and not just their own agency. So it's really look at what's best for Warwick County. Like I said, it was pretty much daily work of reaching out, relationship building, meeting with people for about 3 or 4 months.
So I just want to summarize a few of the real key points here. One is there's 12 sectors, and Marge's role was to reach out to every sector. Another point that's really important is that the phase takes some time, 3 to 4 months, we're talking, that people need education. So an important component is people gaining education. And then lastly, getting people to shift their mindset into not just what's good for my own agency, but what is good for Warwick County. So they're kind of making a paradigm shift there, if you will. So it sounds like it can be an intense process, and you survived all of that.
I did survive, yes.
What were the next steps once you got everyone together?
I think I actually came into the CN tray a few times.
Yes, yeah, you did.
So that first process is really capacity building, which is a continuous. You're just constantly bringing people on board. So the next one was assessment, and so we looked at various data sets. For example, the Indiana Youth Survey from IU Public School of Health that the students take across the state in 6th through 12th grade. So it provides perception of risk, parent perception of drug use, as well as student 30-day use, and what are the substances and what age do they start and things like that. We look at census data, where in the county and city are the needs. Work is both urban, suburban, and rural, and they all have different needs. We looked at kids count data. We definitely looked at Sheriff Department arrest records and coroner data. We looked at Department of Education for dropout and graduation rates. We looked at anything that would really give us a picture of what Warwick County is like from the most objective criteria. So data is important. It's really the core of the SPIF. Sometimes there can be a perception with people around the table that there may be a big problem, a teen pregnancy problem at one of the high schools. And while you can recognize that yes, there are these issues, if the data doesn't direct us there, that's not where we're going to go. We keep an eye on it because it might bubble up, but we aren't going to really go and focus on teen pregnancy. But we're going to look at what the other data sets are telling us. So it's really important for people to keep an open mind so they can look at that carefully. And really the strengths in it is all the sectors come to understand prevention better and not just look at bad outcomes. Some of organizations, and not picking on law enforcement, but they're dealing with tough things. So a lot of times they're looking at things from that point of view. So I feel very fortunate with Warwick County law enforcement that they fully understand that really a lot of their job is to help prevent and to be a support for families and youth, so they don't get to that point where there's an issue.
Right. What strikes me about this process, of course, is so like the process Youth First went through when Dr. Wooten gathered together community leaders and began looking at data that reflected the needs of students within our community. And so looking at that data helps move beyond sort of those preconceived ideas about what's actually going wrong or where the problem lies. And I'm curious to know, though, in this process, what were some of the barriers you experienced in your coalition about helping people maintain an open mind and also just to ask good questions from that kind of open-minded place?
A lot of education. Obviously, people need to have a clear understanding of what the process is, what the outcome, we're looking at. Initially everybody around the table doesn't know what's going on. They have their own ideas. What is it that needs to happen? So there's a continued need, even now 10 years in, to build relationships. So there's trust, respect, and transparency. And that's one of the things I really want to make sure too, that everybody understood this is not a Newburgh or Boonville strategy. It's all of Warwick County. So we have meetings throughout the county. They'll be in Linville, they'll be in Oberfeld, they'll be in Newburgh, they'll be in Boonville. So we make sure that we're really reaching out. In the beginning, you kind of feel tension between some of the agencies and things like that, because they have their own convictions and their own agency requirements, which you understand. And but what I feel now is people do have an understanding that what the coalition is doing is for the best of Warwick County. So I have not really felt that tension over the past number of years, but I'm always careful with it too. So a lot of education goes into this.
Sure. As well, you talk about the building of the relationships and the helping people move beyond like what their own perspective is into having a broader perspective about the county as a whole instead of just like their area. As you looked at risk and protective factors, how did you go about prioritizing? And also, were there any surprises or kind of ahas in the data as you looked at things?
So through the Indian Youth Survey, one of the nice tools that's in that is there's a page that lists the different risks, high risk factors and low protective factors. And so if it's something that was over 50%, we would start to look at that a little bit deeper. Even if it was like 48 or 49%, we thought, okay, well, that's close enough.
So you had a threshold and you kind of went there and that helped.
Exactly. Yeah. So, we found one high risk factor is parental conflict. Not always surprising, but arguing with parents on a regular basis, not just your normal teen arguing, but more intense, daily, yelling, things like that. So again, we looked deeper into parental conflict, and but we wanted to find 2 to 3 risk or high risk, low protective factors to focus on, so we could do our best with those. Obviously, there were probably some there was more. But these were the 3 the coalition agreed we felt were the highest need, and that's where we went with that. And there weren't any real surprises with those.
Okay.
Yeah, not really a surprise.
Sure. So if you would talk a little bit about family conflict and what discussion the coalition had about that.
Sure. So those risk and protective factors are listed by grade, which is really helpful. And you can see between 8th and 10th grade, there's a big increase in issues with interaction with antisocial peers, with parental conflict. And so, it made sense to us to look at that based on development. And so we really, wanted to make sure that we were addressing, 8th and 10th grade, understanding truly though that prevention starts younger. So we have additional, we were looking at the planning, and then as we started to look at implementation, what are some of the strategies that we can reach down into to affect these in 8th and 10th grade.
Okay, wonderful. So tell us, what risk factors did Warwick County decide these are going to be our focus and to address?
Okay, so obviously I've mentioned parental conflict, interaction with antisocial peers, so teens are hanging out with the wrong kids. Those are the two highest risk factors. Every 2 years we look through the data, and we go through this whole process again of the SPIF, and we evaluate the data, where's the main issues, and these two have been pretty consistently up there. There was one low protective factor where students felt that they had low community support, even if they were doing positive things. So we wanted to make sure we were addressing that as well.
So the kids felt noticed if they were doing good
Exactly.
things. Okay. So once you figured out, okay, we want to address these 3 factors, what was the next step to help you out?
Okay, so we went into then planning and kind of implementation. So we broke into small groups and researched evidence-based programs and strategies that are found on registries. And once we collected those as a coalition, we looked at what was the best fit in the community, what was the cost, what was the reach, and what are the outcomes that those strategies already had. The idea is to address those concerns through programs, policies, and environmental strategies all together. So that really makes the best practice approach. So for example, parental conflict, we already had Youth First, who is one of our partners.
Yep.
And so we were able to put in strengthening families in various schools throughout the year. One of the things that came up very early on is that we realized that Warwick County did not have the United Way 211. So there was not really a resource guide, and the one that was available was pretty dated. So we provide a resource guide that is presented or given to the schools, given to prosecutors, to our partners, anybody who wants it. What did I do?
Oh, I bet. Did we get signed out because they signed on in the other room? Gee. It says we're still recording though.
Oh, maybe we'll have to edit that out then. Okay. End meeting. Leave meeting. Cancel. Please assign a host before you click. You got me, Davey.
It says it's still recording.
Okay. Let's
But
keep
it doesn't
going.
like it.
It's up there, it says recording.
Yeah, it says
All right, you have to edit that out.
recording.
Okay, so we have the resource guide, what resources are available. And so that is definitely a support for parents. For example, before I started Youth First, I did not know Youth First had social workers, and they were in the schools. And so, we list a lot of different organizations. It's a very easy brochure. So we also looked at policies that the school corporation had in place to address different risk factors. We found a gap that there's no policy for school corporation, for the Warwick County School Corporation, for alcohol use for adults on school property. And this was a huge surprise. So we formed a committee to look into school policies. And through that discovery, we identified there was tailgating with alcohol going on at sporting events, both middle school and high school. This was a surprise because, it's like you would just think it was a given that there should be some kind of policy that would address that. We learned that open container law is strictly when driving a car in Indiana. You can walk down the street carrying a beer or drink, and as long as you're not acting stupid, you can do that. So the committee agreed a policy was needed to be presented to the school board. The chair presented our findings to the superintendent, superintendent presented it to the school board, and a policy was written, and the public attendance policy prohibiting adults on school property to have alcohol was passed. So it was a win for the coalition, obviously, but it was a win for Warwick County. You're affecting thousands of people who come on school property. So we have that, and then we also have the programs that help with skill building for parents and children and youth. And then we also have the social norms, the Truth Is Social Norms campaign to affect norms that alcohol is okay and promote that positive.
You know, it's a combination. The coalition is forwarding the work that is program, policy, and environmental strategy
Exactly.
all at the same time.
Yeah.
So it's more than just like helping one child at a time. You're
Exactly.
really trying to move the entire county forward.
Mm-hmm.
All right. Well, do you feel like tailgating has declined?
I do. You know, once the policy was passed, we did follow up with principals and law enforcement. So it has declined at sporting events. We were, as a coalition, able to provide signage for the athletic fields that says no alcohol. And then at a last year at a high school football game, one of the visiting schools' parents were tailgating with alcohol. And the next Monday, the principal from one of our schools called that principal, that's the visiting school, and said, "We don't allow that here." And so, you know, please don't, make sure your parents know the next time that they're not going to be allowed to do that. So there's, you know, that was a cool story to hear about.
You know, I think that it's so cool to see that Warwick County was able to take that sort of step in policy. And also, this is just such an interesting conversation, Marge, just for our organization to be aware of all the work that's going on. I'm curious to know, is Warwick Care still continuing, and what else would you like to share about the process?
Yeah, so we are, like I said, Davey said earlier, we're going into our 10th year, which is really exciting. One of the things that was that's been cool is that when this process first started 10 years ago, the idea from the state was for every county to have a prevention coalition, and really that did not happen. I think maybe from the original 14, there may be 5 that are still existing. And so we're really proud
that the state had to change directions on the way they were going to address
exactly
prevention,
yeah
right?
So this has been really a really good process. It's been really interesting working with the communities, and so we're always building new capacity. We're always bringing new individuals in who want to be a part of our work. So we're always looking at sustainability. You know, what do we do after those 10 years are up? So it's been a very positive experience for both the county and for Youth First. And one of the things we're looking at now is the vaping. And so one of the high school principals and I went a couple weeks ago and met, addressed the county commissioners. And you just, again, it's that beginning conversation and relationship building of, this is who we are, this is what we care about, and we want you to care about it too. So it's good. It's a continuous process, making sure we're viewed as leaders within Warwick County.
Well, I want to thank you all for tuning in. I want to say a huge thank you to Marge Giannopoulos. Marge is really a leader in getting this work done within our state, and we're fortunate to have her. And we're also just really fortunate as an organization to be able to see the Youth First prevention model move forward in all sorts of different ways. So thanks so much for tuning in, and thank you, Marge.
Thank you, David.
It's a wrap.
It's a wrap. Okay.